Okay, so we'll be live on YouTube.
Mr. Zion, Mfon has been there waiting for you to allow her in.
I didn't see her. What name is she using now? I can't see. I can't see him phone. What's the name she's using? What's the name? What's the name she's using? I didn't see him form now. There are plenty people. There are over 17 people. I can't admit all people. I can't see her name. I'm looking for Inform. That's the name I know. What's the name? What's the name she's using? I didn't see Inform now. There are plenty people. There are over 17 people. I can't admit all people. I can't see her name. I'm looking for Inform. That's the name I know she used. What's the name? What's the name she's using? I didn't see Inform now. There are plenty people. There are over 17 people. I can't admit all people. I can't see her name. I'm looking for Inform. That's the name I know. Hi, Inform.
Ineoluwa.
Good morning, sir. Can you hear me,
doing?
sir? I'm
Yeah,
fine,
good
thank you,
morning.
sir. Very
Okay,
clearly,
good.
sir.
Okay. So I'm trying to manage the YouTube. Yeah.
Sir, can you hear me, sir? I'm fine, thank you, sir. Very clearly, sir.
Okay. Okay. So I'm trying to manage the YouTube. Yeah.
Sir, can you hear me, sir? I'm
Yeah.
fine, thank you, sir. Very clearly, sir.
Okay. So I'm trying to manage the YouTube now. I'm trying to manage the YouTube. Yeah.
Sir, can you hear me, sir? I'm fine, thank you, sir. Very clearly, sir.
Okay. So I'm admitting everybody now. We're starting right away. I'm admitting everybody. So I'm admitting everybody now. We're starting right away. I'm admitting everybody. So I'm admitting everybody now. We're starting right away. I'm admitting everybody. Okay, good morning, everybody. Thank you for your patience and thank you very much for joining. We are starting this conference live and right away. Let me acknowledge all our esteemed, distinguished special guest speakers. Particularly, I want to acknowledge Sarah Klein from the United for Global Mental Health. Thank you very much for joining and joining very early and right on time. It's a pleasure to have you. I also want to acknowledge all our guests. Please, we are privileged to have you join us in this year's International Mental Health Conference. We'll be handing over to the moderators and they will take us through. Thank you very much. And it's a pleasure having you on this very important conference. Thank you very much, Sarah. I appreciate your time. Join us in this year's International Mental Health Conference. We'll be handing over to the moderators and they will take us through. Thank you very much. And it's a pleasure having you on this very important conference. Thank you very much, Sarah. I appreciate your time. Join us in this year's International Mental Health Conference.
Miss Ineoluwa, please, the saddle is yours. Good morning. You're welcome, Miss Ineoluwa. My name is Emeka Amodi. I'll be anchoring with Miss Ineoluwa. You're all welcome. She will take us through the first phase of this engagement this morning. Miss Ineoluwa, the ball is in your court, ma'am.
All right, good morning, everybody. Good morning, good afternoon, and good evening, distinguished participants joining us from different parts of Africa and the global community at large. And I would like to say that on behalf of the African Mental Health Reforms Organization, Africa, I warmly welcome every one of us to today's main conference sessions. And I would like to see our thumbs up, our emojis flying if you're excited to be here. Thank you very much. My name is Abambang Umfon, and I would be moderating today's conference. However, I just really want to set down some few rules, just so that we can enjoy a smooth conference today. I would like to ask that we ensure that our microphones remain muted unless we are called upon. And also please, that our display names are properly identified so that we can, identify everyone promptly. And also, when we'll be making contributions in the chat, please, I would like us to remain respectful and professional. And then we also encourage active participation throughout all of our discussions today. Thank you once again for joining us.
Thank you for inviting me to be here today. I think, Zion, if you're comfortable, then I'll start my presentation.
Sarah, could you give us a minute? Let's take the Zambian anthem.
Today, I think, Zion, if you're comfortable, then I'll start my presentation.
Sarah, thank you so much. Can you give us a minute? Sarah, could you give us a minute? Let's take the Zambian anthem.
Today, I think, Zion, if you're comfortable, then I'll start my presentation.
Sarah, thank you so much. Can you give us a Sorry for that network glitches. Mr. Emeka and Ufon, can you confirm you can hear me? Can you confirm that you can hear me?
You're audible. You're live. You're on your.
Sorry for that network glitches. Mr. Emeka and Ufon, can you confirm you can hear me?
You are live on air. We can hear you live and clear.
Can you
Maybe
confirm that you can hear me?
speed devices. You're live. You're on your.
Can we all please take the Mr. Emeka, can you confirm you can hear me? Let's take the reading. Let's take the reading of the Amra anthem, please. Can we together take the reading of the Amra anthem? Can we all please take the Mr. Emeka?
I'm already sharing my screen so that we can also see the anthem and take it together.
The Amra anthem, please. Can we together take the reading of the Amra anthem? Can we all please take the I'm already sharing my screen so that we can also see the anthem and take it together.
Please, I would just like to ask that if we're using two devices, we can just mute one so that it doesn't lag or re-echo. Thank you very much.
We can't hear you, our moderators. We can't hear you read so that we can follow you.
Oh, all right. I said that if we are using two devices, please can we mute one so that we don't experience lagging and we can hear me clearly.
Yeah, we can hear you. Let's go ahead. Let's go ahead.
All right. So the Amaral anthem I would read. The title is Harmony of Transformation, verse 1. In the heart of Africa, a vision takes flight, transformative reforms, a beacon of light, a chorus of voices, a network of hands, breaking the stigma, healing the soul. From the desert to the seas, a promise profound for mental wellness, our common ground. Chorus, harmony of transformation, echoes so grand, African spirit rising hand in hand. Funding, integration, research, our guide for a healthy, productive Africa tide. Amaral, the anthem we sing, a vision realized on hope's wing. Transformative spirit, forever our song, in the heart of Africa, where we all belong. Verse 2, breaking down barriers, building bridges wild. In unity we stand, side by side. Increased funding flows, a lifeline strong. For the silenced voices, we sing along. Beyond the challenges, we find our way. Nurturing compassion, dispelling dismay. In the rhythm of progress, we take our stride. For every soul, a safe place to confide. So let's take the chorus together.
No,
Harmony of
let's go to verse
transformation.
3.
Okay, all right.
What time?
Service, all right. Service integration, like rivers that meet. Minds united, no challenge too steep. Research blooms, a garden of insights, nurturing wellness, morning till night. In a tapestry of progress, stories unfold. Productivity lives leaves a future untold. African descent and strong in the symphony of reform. We all belong. I will stop sharing now. Please, can we mute our mics? Can we mute our mics now so that we don't have flagging? All right, thank you very much. I would just like to also share my screen so that we can get on with the agenda of today's conference and be very swift in what we're doing because of time. We value your time very much. All right, moving forward today, we would go straight into
do we have Dr. Hope? Dr. Hope, can you quickly give the 2 minute opening remark? Dr. Hope.
Hello, good morning. Good morning, everyone.
Yeah, good morning.
Thank you very much. I would like to welcome everybody to this great initiative that has been put in place. And thank you very much for voting Zambia to host. I will not say unfortunately, I'll still say fortunately, we are still able to hold it virtually. I'd like to welcome everyone. Looking at the background where we are coming from, we're here to share a common goal in how to promote and develop the mental health policies across Africa and worldwide. It is a great pleasure from Zambia, the LOC team, the people who have been in the background, to have everyone come on board at a time like this. Despite having few challenges, it is what it is being done. And we'd like to appreciate everyone who's here. As we even start our deliberation for the 2-day conference, we'd like to encourage everyone to participate, everyone to be interactive, even to share the word across. We can speak to a neighbor, we can ask a neighbor to speak to a neighbor, and we take the word as we have more people on board to come and benefit from this great initiative. With those few words, I would like to thank everyone who's here. With those few words, I would like to pass on to the moderator. Thank you very much, everyone, for coming.
Thank you.
Thank you, Dr. Hope. We are proud to have that intro from you. I'll just hop in a little bit. My co-host, Mfom, will be joining up soon. Please, we want to know if Professor Balewa is presenting and is ready to go.
Okay, thank you very much, distinguished moderator. Allow me to quickly take a welcome address, and then I will be welcoming Sarah, a very special distinguished guest speaker on this very important conference. I will quickly just share my screen. I will just go through very fast to present my welcome address for this very important conference. I'd like to welcome everyone to this International Mental Health Reform and Care in Africa Conference 3.0. I want to particularly, again, reemphasize the theme of this conference. Distinguished ladies and gentlemen, we are looking at a very, very unique and important theme, looking at transforming mental health systems in Africa through policy, partnership, data, and people-centered approach. Distinguished ministers, policymakers, development partners, researchers, advocates, professionals, traditional and faith leaders, youth champions, and African across the diaspora, and our amazing host, Zambia. I want to thank you very much for making it a duty to be on this very, very important call. I want to say that you are highly welcome to the International Mental Health Reforms and Care in Africa Conference 3.0. We are gathered at a very defining moment for Africa, a moment that calls not for silence, but for bold action. Today, more than 116 million Africans are estimated to live with mental health conditions. Yet many African countries allocate less than 2% of their head budgets for mental health. That is very appalling. Across the continent, treatment gaps remains a huge concern, over 75 to 80%, while millions continue to face stigma, exclusion, poverty, and a huge lot of displacement are recorded almost every day. Now, distinguished ladies and gentlemen, I want to just mention here without fail, please permit me, that what we see across the continent of Africa, whether it be in terms of the stigma around mental health or the exclusion that we see among the people who are living with the condition or poverty that's ravaging the deep parts of the continent, or conflict, displacement, unemployment, gender-based violence, and humanitarian crisis, these have impacted adequately psychosocially to the people of Africa. Now, just to say, our vision at AMRA is to build a mentally healthy Africa where every individual thrives, productivity remains optimized, and mental health is fully integrated into developmental system. Our mission is to lead a Pan-African multi-sectoral consortium that advances mental health reform, policy influence, system integration, data system, and community-driven care across Africa and the diaspora. Mental health is no longer a hidden issue. Mental health is development. Mental health is security. Mental health is productivity. Mental health remains a huge human dignity that must be upheld by all. Now, we have Theodos tell us that there is no health without mental health. We can't excuse the conversations of mental health when we are truly looking at health holistically. Now, may I quickly say that across Africa, insecurity, violence, conflict, terrorism, climate disaster, forced migration, substance use, and economic hardship are placing unprecedented psychological pressure on our communities. Women and young people remain disproportionately most affected. Now, climate change is no longer only about the environmental issue, it is a mental health concern. Conflicts are no longer only security matters, it is a mental health concern. Unemployment across the continent and social exclusion are no longer just economic issues, they are mental health concerns. May I also mention that Africa cannot achieve the Agenda 2063, the Sustainable Development Goal, or the Peace, Innovation, or Economic Transformation, while millions of Africans are being ravaged and silently struggling without access to quality mental health care across Africa. Yet, there is hope. The AMRA journey itself reflects Africans' growing commitments to reform and collaboration. The Conference 1.0 was successfully hosted in Abuja in Nigeria, the headquarters of AMRA, where we began building a continental movement for mental health reforms and care for Africans. Now, the Conference 2.0 was held in Cape Coast in Ghana last year, in a strategic partnership with the Mental Health Authority in Ghana and Ankofor Psychiatric Hospital during the historic 60th anniversary of Ankofor, under the theme, Transforming Mental Health Systems in Africa, Again, we considered partnership, policy, and people. We strengthened regional partnership and advanced a shared Africa vision for mental health transformation. Now, today, we are face-to-face in the conference 3.0, where we are moving from dialogue to implementation. Now, across Africa, momentum for reform is growing. Countries including Ghana, Kenya, Rwanda, South Africa, Zambia, and Nigeria are advancing policy reforms, suicide prevention initiative, community-based care, digital mental health innovations, and integrating mental health into primary health care system. Now, we want to acknowledge the importance of the work that have been championed by WHO Special Initiative for Mental Health in Africa, Africa CDC engagement, youth-led mental health movements, humanitarian, psychosocial, and support programs, and regional policy dialogues across the continent. AMRA remains committed to partnering and participating in these strategic platforms and strengthening collaborations towards building mentally healthy Africa. Now, let me close my welcome remark by saying we cannot build an effective mental health system without of insecurity and displacement on our community. The psychological effect of climate change on women and youth, suicide trends and substance use pattern, workforce shortage and treatment gaps, the social and economic costs of untreated mental health conditions in the continent are huge and quite appalling. And we look forward to saying that this conference will be opening up conversations and looking forward to addressing quite a number of these. May I close my remark by saying that please, there are a lot we want to unravel, particularly we'll be unfolding some dashboards that will be serving as the mental health intelligence for Africa, and quite a lot of innovations in this conference. Please sit back and let's together enjoy every moment of today. It is time for us to act. It is time for us to collaborate. It is time for us to invest. It is time for us to transform mental health systems in Africa, and it is now. Thank you very much, and you are all most welcome. Thank you. May I quickly, humbly welcome Sarah for her presentation. Please, let's make welcome Sarah.
Thank you very much, sir, and it's for your kind introduction to me earlier, and then also thank you for everyone for being here. Excuse me. I'm afraid I have very limited time, so I'd be happy to make my remarks and then share a presentation, and I understand that you will then have a further discussion amongst the panel. I'll do this with a PowerPoint just to make it quicker for you. In terms of what I wanted to talk about today, it's really, it's about the changes that we're all experiencing and what they mean. So as we all know, the context has shifted in the last 4 years in particular, in terms of the fracturing multilateralism, the deep aid cuts, the rise of regionalization and rights erosion. I think you will all see and discuss the new threats or opportunities for mental health in terms of the economic pressures that we are all facing, the impacts of the changes in the environment, and then the positive or negative impacts of technology. I think one of the things to discuss as well is overall the need to defend and expand mental health within the global health architecture. So it's within the future of health as it looks at a global level in terms of the different organizations supporting member states. Fourthly, the competition for global funding, which we'll talk about a bit more, and how we focus increasingly on national and individual financing and ways to overcome stigma so that we can move from policy reform to funding and secure and multi-year funding. I don't know how many of you are following the global health architecture process, but this is the way in which organizations such as WHO, but also the Global Fund to Fight AIDS, TB, Malaria, and other organizations will be looking at what they do and why they do it. It's an opportunity for us to shape it in a way that supports mental health, but also is more fairly reflecting the views of the countries that traditionally have been recipients of aid. In the context of the global discussions, the Accra reset is very important, and this is the effort led by African leaders to really advocate for a better system that fairly represents what member states or governments would want by way of a national health plan and the support for that plan rather than donor-led prioritization. At the same time, as you know, bilateral aid is declining by as much as a fifth within the past year. But there is potential for multilateral development bank increasing their support, including for mental health and philanthropic funding. On the continent of Africa, there is the opportunity to leverage organizations, including the WHO's Afro regional office and their networks, the Africa CDC, the AU, etc. All of them are talking and doing work on mental health, and all of them are opportunities to engage and drive funding. Ultimately, sustainable funding is a national priority. It will require government commitments year on year tied to policy and outputs. And that has always been the ultimate goal for us as an organization who does international advocacy, but also as the Secretariat for the Global Mental Health Action Network, with over 10,000 members in 170 countries, of which Zion is a much treasured member and has been a representative at global level for the network. So in terms of next steps, the things that we are doing is making a strong case for why mental health matters within health. Meeting health ministers last week at the World Health Assembly, they are very clear that they understand the burden they face today in terms of both communicable but also non-communicable diseases, the concerns that they have around heart disease, diabetes, etc., at the same time as concerns around HIV, TB, and now, of course, Ebola. What we need is an approach which combines mental and physical health, because as we know, that's the most successful and sustainable. So we have to keep making the argument for why mental health matters within health. At the same time, in order to drive more funding for mental health, we have to explain why mental health is a current and future determinant for economic health. Governments that invest in mental health will have better economic productivity and will reduce cases and deaths, for example, from those who are living with issues such as HIV or TB. It means that more people can return to productivity roles within the workplace, within their communities, and the support for their families. So these are things that we are clear that it's important to continue to advocate for, and I'm sure many of you are. The next step. We see clear next steps in terms of building alliances, particularly within Africa, but also with other nations and continents who want to change or advance through things such as trade agreements or international agreements. And at the same time, we know there are other sectors, including climate and the environment, where people are more and more willing to look at the intersection with mental health. So we do need to build these alliances, and obviously this network is a key opportunity. The second thing I wanted to say is to leverage processes, global and national. Over the next period, you have a number of years in which there will be discussions about the future of health. That includes the financing models and the delivery mechanisms. It includes global financing, and I've included here the GC8 awards, which is global fund financing, but also the IDA replenishment, which is World Bank funding. At the same time, you have political conversations. You have high-level meetings on HIV this year, universal health coverage next year, and others in the following years, most notably the next UN high-level meeting on NCDs and mental health in 2031. These are opportunities to negotiate with other member states and to encourage your member states to prioritize these issues. Finally, there is a specific opportunities for the African region. Next year, there will be a ministerial summit on mental health, which will be held in Kigali in March. Prior to that, there are regional consultations. There is one happening right now in Johannesburg for Anglophone countries. There is one happening in Togo for French-speaking countries. These are important opportunities because they are involving members of health ministers along with civil society. They are important moments for the mental health community to be advocating for investment and for policy reform. Therefore, it's important to use these global and regional processes to advance change. Those are the things I wanted to mention today, and I hope that's a useful presentation. Thank you.
Awesome. Awesome. Thank you so very much, Sarah. It couldn't have been any better. Thank you so much for your very, very detailed presentation. We're most grateful. We're most grateful that you could share your time with us. And if I'm allowed, I want to also use this opportunity to thank you for the global leadership role you're leading for mental health advocacy. We thank you so very much. Thank you for all you're doing, not only for United for Global Mental Health or the Action Network, but also for mental health across the globe. Thank you very much for all you do, and we sincerely appreciate you dearly. And thank you for making our time to join us in this conference. Thank you so much.
Thank you, Zan. Thank you.
Okay, so I will now hand over to Mr. Emeka and Ms. Mfong, and we will just take some few goodwill messages. And I know that some of our guest speakers and keynote speakers are also on the call, and then we'll be hitting to hear from them any moment from now. Thank you very much. Over to you, Emeka.
Yeah, thank you, Sarah. That was beautiful and that was punchy. Thank you. It was also pretty informative. We appreciate you. I wouldn't know if we have Professor Oye on the call for his goodwill message. If we don't have him, we can move to another one. He's one of our founding mentors and pillar for AmRAO since inception. Is Professor Oye Guruji on the call, please, this morning? Looks like he's not yet on the call. Can we have Dr. David Okoha, Permanent Secretary, National Assembly? Okay, just a few names that will be giving us goodwill messages. If at any time you set an eye on them, do let me know. We have our amiable Angitera Beauty of AmRAO, Liberia, Dr. Tunji Ojo, National Mental Health Program Coordinator, Federal Ministry of Health. We're also going to be having some country directors of NGOs. Please do notify us quickly once these persons are on the call. You have about 2 minutes to give us your goodwill message in the course of this program. So if we have Professor Guruji Oye, one of our pillars and founding mentors for AmRAO, please do alert me and I will call him on the call. In the absence,
if I may interject, Honorable Emeka.
Yeah.
I think we have one of our guest speakers. One of our guest speakers. I think we have him, so we can just take him while we take more goodwill messages as they come. I don't know if that's okay. We have Mr. Ogumba. We have Mr. Ogumba, one of our lead speakers. So I think maybe you can just call him up.
Oh, great.
Mr. Ogumba, can you just allow me to just welcome him if it's okay, please?
Go ahead, sir. You're already on the call. Go ahead, sir.
Okay, thank you so much. So, our keynote speaker, Mr. Ogumba Ebota, is a researcher and a fellow of the Institute of Research and Policy Integration in Africa, Indiana University, USA. He is a trainer, a facilitator with extensive experience in strategic research, policy development, peace support operation, capacity building, strategic studies, and comparative politics. His research is foreign policy analysis, child protection, conflict management, organized crime, humanitarian intervention, and gender dimensions of conflicts. He is a reviewer of several international scholarly journals. He develops training curriculum and facilitates training. Please, distinguished ladies and gentlemen, join me. Let's welcome Dr. Buta, who is also an accredited mediator. He has published widely in reputable journals. Please help me welcome our very distinguished special guest speaker. You have the floor, sir.
Thank you so much, Pastor Zion. I don't know if you can hear me.
Loud and clear, sir.
Okay. Thank you so much for that wonderful introduction and for inviting me to give my brief remarks at this very important conference. I am not taking it for granted. I appreciate this. I consider myself a friend of this organization and a self-appointed member. Thank you. The discussion on mental health, I will say briefly, is something that is timely, particularly in our world today that people are under a lot of pressure from workplace, pressure from home, pressure from economic situation, and so on. All are building up and, leading into different kinds of mental issues that are also culminating into health issues. So that is why I think the theme of this conference is very important, particularly for African continent. And I will also link this to where we are coming from. If we look at where we are coming from the foundation of the continent, looking at the liberation of Africa, economic emancipation, political emancipation, and independence of Africa, where we are today, everything boils down to, how Africa have navigated different struggles in life, different landscape and all that to where we are today. So that's, I would say, is a timely topic. So I will start from saying that mental health advocacy, particularly within the context of African and what I would call Pan-African movement, is not just what I will call a medical necessity. It is also a vital act of collective healing and self-determination. I would say for generation, global African communities have navigated the compounding psychological impacts of historical trauma, from what African faced during slavery, colonialism, and where we are today, even as Africa is still struggling, to navigate all these troubling waters and all that. So I would say that systemic inequalities and displacement, to speak of Pan-Africanism today, is to recognize that the true liberation cannot exist without psychological well-being of Africans. So, key to my intervention today, I will say that we must dismantle the myth that mental health struggle are foreign concepts. They are not, what we perceive as foreign concept, but is a sign of, I would say, is a sign of weakness if we see it as foreign struggle. Rather, is a struggle that is internal currently today because it's culturally relevant, to mental health care, which is also a fundamental human right. Because when one is not mentally stable, I would say it is a human right issue, because the primary responsibility of every government is to ensure peace, security, and stability of its citizens. So every citizen must be mentally stable to be able to, perform its primary role, both as individual and in contribution to development of every nation. Then moving from there, I will also take us to what we call embracing Ubuntu as a framework, which is, by interpretation, what I will say, I am what I am because we are what we are. So through healing happens only in communities, and it is by leaning into the philosophy of Ubuntu, which is I am because we are. I cannot be because we are not currently. So we can only build community-led support system that counter isolation and foster resilience across the continent of Africa and the diaspora. Then this will take me to what I will also call decolonizing mental health, which is advancing Pan-Africanism, which means validating African indigenous knowledge system and blending them with the modern psychological practices to create holistic, accessible mental wellness framework. Then, in concluding my remark, I will say that our minds are the frontiers of our freedom. As we celebrate our shared heritage and continental unity, let us also commit to nurturing our mental wealth by lifting the burden of silence around the mental health. So we heal our past, strengthen our present, and secure a resilient future for the global African family. Thank you so much as I end my brief remarks with this quote. Thanks. Can you hear me? Hello, can you hear me?
Yes,
Thank
sir.
you
I can hear
very
you
much,
loud
sir.
and clear. Thank you very much, sir.
Thank you so very much. We can hear you so loud and clear, and thank you for taking us history lane and doing that very fantastic presentation, helping us to mirror mental health, as a necessity, and also looking at decolonizing and then creating some healing from where we have come from and where we are at the moment. Thank you so very much for that very, very, very brilliant presentation, sir. We really appreciate you. Thank you so much, sir.
You're welcome. You're welcome, and greetings from the United States of America.
Yes, thank you. We thank you for sacrificing your sleep and your time to join us despite the times difference. Thank you so much. But I will be very happy if you can just stay back a little, because I know that there might be one or two questions that we will be happy that you address from the participants.
Okay.
Emeka, do I hand over to you now? We need to call I think Professor Binama is ready. Mr. Emeka? Oh, okay. We will go
All right,
straight
so I
to.
think that you can just move straight to the next person speaking, sir.
Okay, okay. So
Yes, sir.
let me specially welcome her. She is a very special person to us as an association. She is a mother to us, very supportive. The success of 2025's conference in Ghana was largely due to the cooperation and the support we enjoyed from her. The warm reception for the advocacies even before the conference in Ghana, it was all courtesy of her support. Distinguished ladies and gentlemen, I want you to please join me as we welcome our amiable next speaker, Professor Pinaman Apua. She is a professor of psychiatry, a consultant psychiatrist, and she's doing a huge work across the globe for mental health, and particularly for the African continent. Please join me and send in some emojis. Let's welcome this amiable personality. Thank you very much, ma'am. You have the floor, ma'am.
Thank you very much, Doc, and thank you very much for the kind words. Hello, everyone. Kindly permit me to put off my video to preserve some wideband, please. And then let me share my slides if possible. Please, can you see my slides, please?
Yes,
Yes,
ma,
ma'am.
I can.
Okay, all right. Let me put that in. Trying to put it in the presentation mode. Uh-oh. Kindly give me some few minutes. I'm trying to put it in a presentation mode. I'm not able to do that. Oh no.
Hi, there's a tab enable editing. Perhaps that's the problem.
Oh, okay. I'm sorry for the for wasting time, but oh no. Uh-oh. Oh, it's still. Please, do I still have the enable editing there? Okay, maybe good. I think I have it now. Thank you very much, and sorry for wasting time. But I would like to take this opportunity to say a very big thank you to the organizers of this conference and for the honor to be part of the conference and for the opportunity to make this presentation. I would also want to say a very big congratulations to the convener of Amora and his team for the wonderful work that they are doing. Like he mentioned, we had a wonderful conference in Ghana last year, and I have no doubt that this year's conference will be even better. So this morning I am here to share my thoughts on the topic advancing research and context-sensitive care for informed decision making in Ghana. In Africa, sorry. So why has this become important that we have a conversation on advancing research and context-sensitive care? You will all agree with me that mental health has become a growing public health priority globally. And with the statistic that 1 in 5 Africans will experience a mental health condition in their lifetime, that is according to WHO, it is no wonder that mental health has emerged as a critical public health concern across Africa that demands our urgent attention and coordinated action. To make the situation even more dire is our significant treatment gaps. I think it's been mentioned. Research shows us that up to 75% of people with mental disorders in Africa remain untreated, and that highlights our severe gaps in access to care and services. We also do know that diverse cultural, socioeconomic, and health system factors shape mental health outcomes, and therefore evidence-based, locally relevant approaches and solutions are required if we are to move forward. I know that some statistics have been given, but let's take a look again at a few statistics of our continent's mental health landscape. According to the 2024 WHO Mental Health Global Report, over 1 billion people live with mental health conditions globally. Of these, it is estimated that about 150 million people in Africa live with mental health conditions, with an estimated mental health burden of 116 million in sub-Saharan Africa. We are also all familiar, we've just mentioned them, with our treatment gap, which spans from 75% to 90%, meaning that most people needing mental health care go untreated. And again, less than 1% of our health budgets go to take care of mental health in Africa. What is most worrying, however, is the fact that 60% of Africa's population is under 25 years. And this amplifies our mental health vulnerability on the continent. And yet, our youth-specific data is severely limited. To compound all this, our mental health workforce is also woefully inadequate. The WHO 2023 Mental Health Atlas confirms that one psychiatrist serves a population of not less than 500,000 in many African countries, as compared to one in about 2,000 in high-income countries. This makes our situation quite dire. But let's look at what the role of mental health what the role of research in mental health is. I think that as Africans, we must learn to look at research beyond it being an academic exercise or a pathway to publication. Research can actually be a tool for transforming our systems, shaping our policies, and improving lives. It is a tool for decision-making. Evidence from our researchers enables policymakers and practitioners to make informed choices about priorities, interventions, and resource allocations. It can also be used as an instrument for service planning and delivery. Research helps identify service gaps, population needs, and barriers to access. It also helps in the design of responsive mental health services that align with cultural values and community structures. It can also be used as an instrument for advocacy. Our research provides credible evidence to influence public opinion, mobilize political will, and challenge stigma. When it comes to finance and resource mobilization, evidence from research on economic burden of mental illness and cost effectiveness of interventions supports stronger arguments for funding. Last but not the least, it serves as a tool for accountability and transparency. Monitoring and evaluation research ensures that commitments translate into measurable outcomes. That said, however, we do have challenges and gaps in our mental health research. So, Africa's research faced chronic underfunding and inadequate infrastructure, and this hinders the development of our locally relevant evidence bases. Again, Africa continues to face brain drain, with most of our skilled researchers migrating abroad to seek better opportunities. Our data collection systems also remain fragmented and face significant quality issues. All these lead to African perspectives remaining underrepresented in global mental health literature. There is therefore the need for us as Africans to urgently work on contextually relevant evidence to improve this. But what is context-sensitive care and why does it matter in African mental health? When we talk about context-sensitive, we mean cultural adaptation. This is where mental health care is tailored to our cultural, social, economic, and health system realities of our African communities. We mean community recognition, where our traditional healing practices, our community structures, and stigma dynamics that are unique to African contexts are recognized. And again, where we enhance relevance, acceptability, and effectiveness of mental health interventions. But why does it matter? It matters because, first, of our policy research practice disconnection. You realize that our policies are often developed without sufficient local evidence, leading to interventions that miss the mark most of the time. It matters because we still have evidence gaps. Our research findings rarely reach frontline workers in usable, implementable formats. And again, we often do not take the time to get feedback from the frontline services to help improve our policy adjustments and to inform our research policies. The consequences of these are therefore that our programs are most often misaligned, our resources are wasted, and we have poor outcomes for our communities. There is also the need for us as Africans to note that models that we often import for Africa's mental health care are one-size-fits-all approaches and are usually not culturally congruent and often mismatch our resources. And these models, therefore, tend to fail most of the time. What we must look at are approaches that are locally adapted, culturally respectful, sustainable, and community-driven. This leads to improved uptake, better outcomes, greater equity, and lasting impact. Africa has to take note of the fact that mental health care disconnected from context will always struggle. But then, how can we advance our research? First, our research has to be African-led research. Why is that important? It is important because it builds our local capacity. African researchers best understand our local context, our priorities, and the nuanced realities of our communities. Again, it leads to local ownership. When Africans lead our research, it fosters ownership and builds sustainable research infrastructure across the continent. And then it leads to actionable evidence. It encourages development of relevant, actionable evidence that translates into real-world impact. Again, African-led research drives policies and practices that align with our African needs. I put together some research priorities that I think are priorities that as a continent we can take a look at, or we need more of, I should say. So the first being the epidemiological and population-based research. As a continent, most often we still quote world figures that come from or that we import. But there's a need for a systemic collection of data on mental health prevalence, incidence, and associated risk factors across diverse African populations and settings. Implementation in health systems research. I remember since I became a medical officer in psychiatry and then through my residency program, even till now, I have always heard of integrating mental health into existing public health care systems. Yet, how far as a continent have we gone? Could we look into research that would give us better ways of making this work? When it comes to the youth mental health research, from the earlier slide, we saw that 60% of our population is under 25 years. We need more research and data to address the vulnerabilities among the youth. Of course, we need to take a look at our community-based participatory researchers. And then when it comes to the emerging frontiers, there's a need for more research into how we can positively harness digital health to bridge both delivery and information gaps. Again, how can we advance context-sensitive mental health care? First, we need to take a look at our research capacity. We need to establish more training programs and mentorship initiatives for early career African researchers to build expertise. We need to improve our research infrastructure to support rigorous African-led mental health studies. most importantly, I think we need to create more improved career pathways and develop good opportunities for our professionals to encourage retention and reduce the brain drain that is currently that has been ongoing from our continent. Again, when it comes to human resource, as we've already seen, we have a severe shortage of mental health professionals across Africa, which is again not being helped by the ongoing brain drain. So there's a need for us to develop and retain our professionals. We also need to improve on our task shifting strategies to reduce exhaustion among our few professionals and also to expand care access. When we take a look at our data systems, it is one of the critical gaps in African mental health. The lack of robust data collection and management systems across most African countries. We need real-time disaggregated data to guide our policies and to drive our accountability and responsiveness and resource allocation. So there's a need for us to look at our data systems. When it comes to integrating traditional and modern approaches, that I think we are doing well, trying to build a bridge between the traditional healers and professional service providers. But I think that we still need to improve on that and look at establishing formal referral networks between the two. Again, we look at our digital mental health innovations. As I mentioned earlier, there's a need for us to look at how best to positively harness this to improve access to care and psychoeducation, especially in underserved rural population and our youth population. When it comes to financing, as we say in Ghana, this is the elephant in the room. Africa's funding gaps and heavy dependence on external donors threaten long-term sustainability of mental health programs across Africa. It's therefore time for Africa to look at more of its domestic resource mobilization and to create more innovative funding streams. We can look at a national health insurance coverage, example, as Ghana is trying to do now. So we have to definitely look at creating more innovative funding systems. When it comes to multi-sectoral collaboration, we have to note that effective mental health systems does not just involve improving mental health services. It involves proper coordination among health, education, social services, and justice sectors. There's also the need to include our traditional and faith-based healers, like we mentioned, as well as our civil society organizations. But more importantly, think that could we look to regional collaborations and leaderships where we share goals, action plans, and resources to improve mental health impact across Africa? I think that would be a good way to go. Last but not the least is taking a closer look at our monitoring and evaluation research. As a continent, could we endeavor to establish clear indicators for service quality, treatment outcomes, and population-level mental health improvements across the African context? Could we share data to improve program effectiveness, and where interventions are successful, could we expand to new regions while adapting them to local cultural resource and health system context? That, in my opinion, would help lead to the sustainability of the impact of mental health reforms that we make. But it is not all there on our continent. Some context-sensitive care has worked for us. We can take a look at the Zimbabwe Friendship Bench. That has been a great success, which has since been scaled up to over 70 countries. We can take a look at Ethiopia Prime. We can also take a look at Ghana's quality rights. All these give us the motivation to advance on our research and context-sensitive care. Some few recommendations. I think I have brought most of them up during my presentation, but I would like to highlight a few. When it comes to systems, we need to strengthen our data and financing systems. We need to harness digital innovations responsibly. When it comes to our workforce, like we mentioned, we need to build and retain our skilled workforce. When it comes to collaboration, we need to promote regional collaboration and knowledge. How can we go about that? By sharing knowledge across regional networks, more exchange of our best practices, research findings, and innovative approaches. Also, to use our resources more effectively and efficiently as a continent, we could look at aligning our policies, training standards, and research agenda. And of course, platforms like Amura are doing a very good job in bringing us together to share ideas. We need more of these to sustain the reforms and foster advocacy and collaborations across our continent. So my final thoughts. I think that Africa stands at a pivotal moment for mental health reform, and the choices that we make today will shape our generations to come. I also think that Africa must not import its mental health future due to its tendencies to fail. Indeed, I believe that the solutions to Africa's mental health challenges will come from Africa itself, from our communities, our traditions, and our collective efforts. I think that Africa's mental health systems will improve only when research, policy, and care are rooted in our African realities. Last but not the least, I also think that the time is now for our own transformation. Thank you very much for the opportunity that has been given to me to share my thoughts. Thank you.
Thank you very much, Ma, for that. Thank you. Please, distinguished ladies and gentlemen, please can we give a virtual round of applause to Professor Pinaman? That was very insightful and thought-provoking. Thank you very much, Ma. Thank you. All right, distinguished guests, ladies and gentlemen, we move straight into the next speech. And it is my honor to introduce our next speaker. He is the Chairman Board of Trustees of Amura, Professor Taiwo James Obindo. He is a professor of psychiatry, consultant psychiatrist, and is also the president of the Association of Psychiatrists in Nigeria, whose contribution to mental health advocacy and reform continue to inspire and change across Africa. Please, distinguished ladies and gentlemen, kindly with your emojis, give a round of applause as I ask Professor Taiwo James Obindo to go ahead with his keynote speech. Thank you very much, sir.
Good morning, everybody. Hello.
Good morning,
Can you hear
sir.
me?
Good morning, sir. We can hear
Good
you
morning,
loud and
sir.
clear, sir.
Good morning. Good morning.
Must apologize that I'm having significant network challenges, and I will therefore, I've used about 3 different, what do you call it, 3 different networks. But I will try and see what I can do in the interim so that you can follow me. The slides I will share is a very big issue. My, what do you call it, is not functioning. My webcam, the camera on my laptop is not functioning well.
and therefore I am using my phone so that you can see me. And I hope I'll be able to join on my laptop soon so I can share the slide. A little correction. You can please let the admin admit me on my laptop so that I can share my, yeah, thank you. I can share my slides. So, well, let me do a little correction. A little correction. I am no longer the president of the Association of handed over in January. I handed over in January. And therefore, I will better be referred to as the immediate past president. So if you can see my slide, can you signify?
Yes, sir.
Okay, thumbs up. Okay. Okay,
Yes, sir.
I'm happy.
If you turn off the video, it might let it be sharper.
The video on the laptop is not functioning. I'm actually using the video on my phone. So that, but then if that may not function well, I can turn off, if you don't mind, not seeing my face. Largely the camera is from my phone. So briefly, okay. I was told that I have 10 minutes and I will be talking about mental health reforms and then professional well-being. We'll talk about enhancing support system for their workplaces. We need to go historical lane, and this is to tell us where we are coming from. There's an adage in my area that said, if you don't know where you are coming from, chances are that you may not know where you are headed. So historically, mental health has always been stigmatized. I remember when I started residency, most of the mental health facilities were located very far off. Some of them in the bush, so that they are far away from other medical specialties, and even access to things are often denied because they prioritize other medical area. And of course, there are toxic culture around mental health, and that leads to emotional concealment. So people are not open to declare that, okay, well, I have a mental health challenge. An average Caucasian can walk up to you and say, well, doc, I am not feeling myself. In the last couple of weeks, I have not been happy, and therefore I need assistance. Rather, in our own climb, people admitting to having mental illnesses are often stigmatized, and therefore a lot of people will refuse to mention that they have a mental health condition. And in a work setting, it impacts on productivity, because somebody who is depressed will definitely may not be able to give his or her best. One, they are absent, which we call absenteeism. Some of them may even be available, but they are not functioning the way they should, which is called presenteeism. They are present, but then they are not giving their best. But thank God, there seems to be a shift in mental health activities, because people are now recognizing mental health as a key performance in corporate world. So over time, there have been policy evolution, expansion from physical safety, especially in the occupational setting, to psychosocial safety. And what are we talking about? We are talking about chronic work overload. We'll talk about the harassment, and of course, the dynamics of working together, which often become toxic if not attended to. So also, government later and is presently mandating that all corporate organizations must do risk assessment by compelling employers to assess and then report and then actively mitigate psychosocial risk within the work environment. So the onus is now on the employers to make sure that their employees not only have physical health, but their mental health is attended to. The new Mental Health Act in Nigeria, which was enacted in 2023, sees that employer must make sure that their employees assess mental health if they notice that there are challenges, and then they support the staff in receiving mental health care. So focus is now on mere workplace stress and then harassment. And harassment comes in various areas. This is not the focus of this discussion, though. Over time, with work overload, with so much issues, burnout is inevitable. And of course, World Health Organization classifies burnout as an occupational phenomenon, which happens at places of work. So responsibility is now shifting to organizations to make sure that not only are they observant the human resource personnel, identify those who productivity are going down, and then they make sure that they identify why such productivity is going down. So there is a need for sustainable workplace structure to identify, to report, and then to make sure that such staff receive care. Of course, the pandemic created another set of work overload, in which there is now no delineation between workplace and home. So there is a blurred interface between work and life boundaries. There's rise in hybrid and remote model functions or model of work, in which case people are now mandated or given some days to work from home, and then other days they are at work, and then so hardly do we have people interacting as well as we used to. Of course, even after the pandemic, the COVID, people still continue like we are doing now. Quite a number of us were not able to travel to Zambia, but we still are here in attending meetings. And there are many online meetings, and some of them last all day long. I've been in meetings where we are there till about 2 a.m. So even sleep is also affected. So what exactly is well-being? It talks about flourishing, not just the absence of illness. We know that the definition of health itself talks about well-being, physical, social, and mental well-being, not the absence of infirmity. So somebody may be well in quote, but the person's mental health is impacted, and therefore it may not be obvious. He still comes to work, he still wakes up every morning and then show up, but over time productivity reduces. And this could be well-being, physical, emotional, social, and cognitive well-being. Some will even add spiritual well-being even to it. So these strategically drive organizational success, because if your workers are not in good well-being, whether it's physical, whether it's social, emotional, or even cognitive well-being, they cannot function the way they should. And that also impacts on economic whatever, because eventually productivity drops, and then people are not, the company is not able to get what they should. So emphasis is now shifted from reacting to being proactive now. So we shift from crisis response, in which people, well, the employee assistance program, in which they may, okay, well, if somebody breaks down, this is what to be done. We are now moving towards prevention, creating an environment, enabling environment in which the individual is able to function and is able to give adequate, give his or her best at work. We also are going towards occupational development, in which there will be some areas delineated for people, like a peace center. And I remember coming to Ghana, the mental health facility there, the Kolebu Mental Health Center, has a room where people, I think they call it a peace room, in which people can go there, you can then relax and then recover somehow, or even have access to psychosocial intervention. So focus is now on root causes of stress, and then this is addressed as much as possible. So also the workflow is also redesigned in such a way that individuals have a better working experience, and of course support systems are put in place so that individuals can actually seek help within the company, work well. Okay. So there are 5 frameworks for well-being in occupational setting. Okay. We talk about protection from harm, connection, and community. We talk about work-life harmony, and of course, being mattering at work. If you are able to, if you are an employee, is given some dignity, is given some recognition, and shown some importance, that you are important in the process of the company, even getting being productive. So, and therefore, so do I matter at work? Is my contribution valued or not? And therefore, if that is done, if I know that I'm valued, it also reduces burnout and makes me to contribute more as I should. So, and then there must be opportunity for growth. Training opportunity must be available. Promotion must be as when it should be. when we talk about protection and connection, first we eliminate psychological hazard. Are there harassment? Are there discrimination? Are there stigma at work? So we must eliminate all those hazards. We must promote diversity, equity, inclusion, and accessibility. And of course, safety of an individual is quite important. Also, we must build trust. We must build inclusion, and there must be mentorship for people to grow their places of work. Harmony, and then being an individual, seeing himself as being important, being of value. So we must respect work-life boundaries. In fact, every worker should have that, even though the boundary is often very blurred, particularly with the current matters that people are able to even work from home. There should be opportunity to promote autonomy. And then when people have leave, their leaves are operational, because I know some medical personnel that they commercialize, they make sure that while on leave, they go somewhere to work so that they can earn more. And that must be discouraged as much as possible. We must foster purpose, we must foster recognition, and then dignity well in place. So there's growth and there's global reform. Career development must be in place so that every individual knows that every 3 years I have opportunity for promotion. And then if I don't, and there are criteria for promotion, and those criteria are made known, and then they are followed. And there should be opportunity for mentoring. Every staff must have one mentor that they can go to if there are challenges, and they can relate with if there are issues, particularly at work. There should be right to disconnect. I don't think I am functioning the way I should. Can I be given a 2 or 3 day casual leave? And every staff should be entitled to such. And then we look at psychosocial risk audit around the world and see that the workplace risk is actually in keeping with global best practices. So in conclusion, we must realize that burnout costs billions globally. In fact, I think somebody was saying that if we don't invest in mental health, we are likely to lose billions of naira. Sorry, billions of dollars now. So if burnout is not taken, so investment must be more in mental health. And it said that if you're able to invest $1 in mental health, what you get eventually is more than $4. So economically, it is wise to invest more in the mental health of your staff. So we also need to have leadership. I was happy that Dr. Apao was also talking about data. Data is important. It is data that drives policy. And if there is no information, we can't convince the, what do you call them? The politicians to do the needful. And then, of course, there must be inclusion in all that we do. So mental well-being is essential for sustainable development, and it must be it must occupy a pride of place. In fact, I see it as the fulcrum upon which the physical and social well-being oscillates and placed, and we must prioritize mental health in the work environment. Thank you very much. These are my references. I'll make sure that the slides sent across. It's a pleasure to be part of this conference. Thank you very much.
Thank you very, very much, Professor Taiwo Obindo. Please, distinguished guests, ladies and gentlemen, please can we use our virtual emojis, to applaud. That was very, very insightful and remarkable. Thank you very much, sir. Thank you. Yes, I see us doing that. Thank you very much. We can do it better. Thank you. All right. In furtherance of the conference, at this point, we'll be receiving goodwill messages from some of our distinguished guests and also partners. And first, I would like to ask that we use our virtual emojis to just welcome Dr. David. Yes, Dr. David Ukoa to give us his goodwill message, please. Do we have him around? Dr. David.
Hello.
Hello, welcome, sir. Yes, we can hear you, sir. You can go ahead, sir.
I want to express my delight and appreciation to everybody here. My name is Dr. Basi Ibokwe, and I'm representing Dr. Basi David Okoha, who is my boss. We work at the National Assembly, the Directorate of Legislative Budget and Planning. Two of us are medical doctors. You would ask, what is a medical doctor doing in the Legislative Budget and Planning Directorate? But that's a different thing. I think it's both an honor and duty to extend these goodwill messages to the participants of the International Mental Health Reforms and Care in African Conference 3.0, taking place in Zambia. We are gathered at a time when mental health can no longer be treated as a secondary healthcare issue or a peripheral social concern. It is now a defining development issue for Africa. If we look around, the evidence is overwhelming. We are quite aware that the World Health Organization says that nearly 1 billion people globally live with mental health disorders, and Africa carries a rapidly growing burden. More than 160 million people across Africa are estimated to be living with mental health conditions. Yet, it's quite pathetic that no fewer than 1.5 mental health workers for 1,000 population, which will be compared to the global average of 9%, 9 per 100,000. These are not abstract numbers. They represent real people, our parents, our children, our colleagues, and citizens. These are indicators of a structural crisis. When mental health is neglected, the consequences emerges everywhere. It reflects an increasing incidence of substance abuse, domestic violence, school dropouts, unemployment, insecurity, displacement, addiction, suicide, reduced productivity, and broken social systems. In fact, the World Economic Forum previously projected that mental health conditions could cost the global economy over $6 trillion annually by 2030 through lost productivity and healthcare burden. Africa will not be exempt from these consequences. Therefore, no nation can build sustainable prosperity while the minds of its people remain under siege. That is why the theme of this conference is not merely an aspirational language, it is a strategic framework for our continent's survival and advancement. What are the things that we need to do? First of all, Africa should scale up its mental capacity, and government alone cannot do it. That is why there is need for partnership. Sustainable products will require coordinated partnership among legislatures, Ministry of Health, academic institutions, donor agencies, civil society organizations, traditional institutions, faith-based organizations, private sectors, and of course, people who live with this experience. The second thing we need to do is Africa cannot continue responding to 21st century mental health realities with outdated legal framework, weak financing models, and inconsistent national strategies. Many African countries still operate under obsolete mental health laws rooted in colonial era assumptions rather than modern rights-based healthcare system. This must change. We therefore need budgetary commitment, not just as a moral imperative, but is very, very necessary. Then third, we have to work on people. Behind every statistics is a human being fighting a battle that society often refuses to see. A mentally distressed population cannot fully innovate, govern, learn, produce, or thrive. Human capital remains Africa's greatest resource, and protecting mental well-being is essential to protecting the continent's future. History has shown repeatedly that civilizations are not destroyed only by wars or economic collapse. They are also weakened gradually when hopelessness, trauma, inequality, and silent disrepair are allowed to spread unchecked among the people. This conference must therefore move from discussion to implementation. It must produce actionable framework, measurable commitments, legislative reforms, financing pathways, regional cooperation mechanisms, and community-based solutions capable of transforming mental health care delivery system across Africa. Let this conference become a turning point. Let future generations look at this moment and say that Africa chose to confront the mental health crisis, not with silence, stigma, or neglect, but with courage, evidence-based policy, strategic partnership, and human compassion. Thank you very much for your time.
Thank you very much, sir. Please, distinguished ladies and gentlemen, can we applaud him for his goodwill message to us? On behalf of AMRA, we say thank you for that wonderful goodwill message. Also joining us for a goodwill message is Mrs. Angie Ta. Is she here with us? So we can move straight into our own goodwill message.
Good morning. Yes, I'm here.
All right, Ma, you can proceed. You have just 1 minute to do that, Ma. Thank you.
Oh, thank you so much. Thank you. And good morning to everyone. Good afternoon. Good evening, wherever you are joining us from. My distinguished guests, mental health professionals, policy makers, advocates, partners, and fellow participants. It is an honor to offer this goodwill message at this 10th International Mental Health Reforms and Care in Africa during this conference. I commend the organizers especially the Association of Mental Health Reform Organization in Africa and the Global Mental Health Action Network for bringing together diverse forces committed to strengthening mental health systems across Africa. As we gathered under the theme, Building a Mentally Healthy Africa, Policy, Partnerships, and People, we are reminded again that achieving mental well-being across our continent requires collective responsibility and action. Strong policies are essential to ensure that mental health becomes a national and public health priority. Governments, institutions must continue to develop inclusive policies that improve access to quality mental health care, promote and protect human rights, prevention, and early intervention. Partnerships are equally important. No single institution, like what the earlier Google message said, no single institution, organization, or government can address mental health challenges alone. Collaboration among governments, healthcare providers, civil society, organizations, communities, families, and international partners is key to building sustainable and effective mental health system. Most importantly, we must keep people at the center of all mental health efforts. A mentally healthy Africa can only be achieved when individuals, families, and communities are empowered through awareness, support, inclusion, and access to care without stigma and discrimination. As we move forward, let's strengthen our commitment to promoting mental well-being, preventing mental health conditions, and creating supportive environments where everyone can strive. Thank you, and may this conference inspire practical actions, stronger partnerships, and lasting commitments towards building a healthier, stronger, and more mentally resilient Africa. Thank you, and I'm happy to be
Thank
part
you
of
very much, Ma, for your kind words and your support towards the vision of Amara. On behalf of Amara, we say thank you very much, Ma, for that goodwill message. Thank you. All right, we also have one more person who would be giving us a goodwill message, and that is Dr. Fran. Please, do we have Dr. Fran with us so that we can move straight into the next agenda? Dr. Fran, please, can you confirm that you're with us?
Thank you, Mfunk. Thank you so dearly. You're doing an amazing work moderating this important conference. Dr. Fran will be making a presentation, but I think we'll be taking a goodwill message from Professor Oshinowo, one of the leading board of trustee members for AMRA. Professor Oshinowo, can we please have you, ma'am, for your goodwill message? Thank you so very much. Professor Oshinowo, do we still have you on the call? Oh,
Yes, she's actually here, but I think her microphone is muted.
Yeah, okay.
Sorry, is that me?
Professor Oshinowo.
Oh, sorry.
Latifat, you'll be coming up very soon after Dr. Fran. Professor Oshinowo, can you hear us? Okay, so while we will again come back to take her goodwill message, I think we can go on to receive Dr. Fran. In other words, if Dr. Fran is not also ready, we can just move so that we can just utilize our time very well. We'll have a lineup of speakers who have assiduously sorted out some research and made some presentations ready for us. I think, Ofong, what do you think? I think we can just, while we hold for two of them, Professor Oshinowo and Dr. Fran, I think we can move to taking some of the but the idea is the breakout section, the panelists we have, we would have loved to take them, we would have loved to go into the breakout section because the panelists are designed into group sections, I think. I'm not sure now. But let me hand over to you, Funk. If it's I know we're supposed to have some panelists before the breakout section. So if the panelists on the panelists are available, please you can just call them to make that presentation while we prepare the minds of participants for the breakout section. We will be ending with the breakout section in today's in day one. But before the breakout section, which is going to be amazingly interesting, we have fantastic speakers at the breakout sections. I want to appeal to our moderators. Maybe we can just go straight to the panel section. You can invite the panelists to make
All
their
right, sir. I
presentation.
think we can move straight into the panelist session, sir. Yes, we can.
Great.
I think that all right, moving straight into the panel session for today. Sir, maybe you could just should I introduce them or you want to just pick up from there?
No, you can just go ahead and but I don't know if you can introduce Latifat and then we can go over and over and get some of them well introduced. But it's just because of want of time, I would have loved that we read their bios. But if they can just take they can take a minute out of their time or maybe 30 seconds so that they can define themselves very well to the audience. Then we can just move further. I don't know if that's okay. We can start with Latifat.
Yes, we can. Over to you, Mrs. Latifat Olagoke. Mrs. Latifat, please, can you hear me, ma?
Yes, I can.
All right, ma, please, the floor is yours. Would like to listen to you, ma, now.
Sorry, do you have my slide up? Do you have my slide up?
We'll work on that right now and make sure it's put up. But I think you can just take like 30 seconds of your time to let us know you and just introduce yourself, ma.
Oh, my name is Latifat Olagoke. I'm based in Dublin, originally born in Lagos, Nigeria. Well, I'm just here to present on a topic of healing the past, building the present, colonial legacy, trauma, and mental health in Zambia, which is the country we are presenting from, and Nigeria, which is the country I was born, and Ireland, which is the country I reside in. I'm also a startup founder of EcoMind, which is an entrepreneurship startup program connected to sustainability, renewable, and mental wellness. So if I'm ready to start, let me know, please.
Please go ahead. Your slide is up. Go ahead.
Right. Okay. When we talk about colonization, colonialism wasn't just about borders, it was about the mind. So this is from the sociological principle of social conditioning. Zambia, Nigeria, and Ireland share the history of British colonial rule. The history didn't end at independence. It's left psychological legacy, cultural erasure, and intergenerational trauma that still shapes mental health today. So, I mean, I don't have enough time to go into what intergenerational trauma is, but it's an overtime of, the punishment and everything. So I'm just going to zoom in on social conditioning. What is it? Social conditioning is the process by which society, culture, family, media, peers, and institutions shape your belief, values, norms, and behavior so you fit into that group. How does it work? It happens through observation, reinforcement, and cultural transmission. You learn what's normal, acceptable, successful, or shameful from people and the system around you. Now, what colonialism left behind? It's left behind internalized shame. Our language, healing, culture are called backward. It's left behind mistrust. Institution felt like a tool of control and not care. And we have collective trauma, which is violent land loss, forced labor, and famine specifically in Ireland. In Zambia and Nigeria, schools and law taught that British way was superior. In Ireland, the penal law and famine did the same. The result is what psychologists call internalized oppression. We start to believe the negative things said about us that show up in today as shame around speaking local language, mistrust of clinics, and stigma when asking for mental health support and help. You cannot treat depression without understanding the context. So the key mechanism of social conditioning, it's modeling. You copy what you see others do and get rewarded. For example, kids learn gender roles, language, and politeness this way. Reinforcement and punishment. This is evidence from the slavery era. Society rewards conformity with approval, status, and belonging. It punishes defiance with shame, exclusion, and legal consequence. And the narrative and institution, school, religion, media, and law tell story about who you are and what matters. Over time, that becomes the common sense. Now, this narrative, is it negatively impacting the whole group of people in Africa, or is it positively influencing it? We talk about the penal law, the colonial legacy. It's this, that has been brought from past to present. Now, language. This language is another key mechanism. The word available to you shape what you can even think. So, example, in many Nigerian Zambia community, mental distress is socially conditioned to be seen as spiritual issue first. So we go to people like pastors, imam, traditional healer before we go to clinics. And in Highland, generation was socially conditioned around silence regarding institutional abuse due to stigma and institutional power. Again, another example is gender role. Boys don't cry. Women should be caregiver. These are all social conditioning and not biological facts. Consumerism, which is advertising condition people to link happiness to buying things. So all this combination of effects affect our mental well-being. So for conclusion, can we change them? Yes, social conditioning can be changed, but it requires collective action. Tools that can be used in changing this are education, media representing all ethnic group, African being one village, one continent, not, connected, unified, policy change, public conversation, leadership, empathetic leadership, and modeling new norms. It's slower because it changed shared norms. Again, my name is Latifat Olagoke, and I'm the startup founder of EcoMind. I hope this message has connected to the title that was being presented today. Thank you.
Distinguished ladies and gentlemen, please, can we use our virtual emojis to really applaud and say thank you and appreciate Mrs. Latifa Olagoke. On behalf of Amara, we're saying thank you for that rich and valuable contribution that you just made to today's conversation. Thank you very much, Ma. All right, we have up next, I want to confirm if we have our next panelist here with us. While we still, appreciate Mrs. Latifa Olagoke. Coming up next, our next panelist is His Excellency Ambassador Dr. Stephen Batibi Ben-Joel, who is the Special Envoy to the African Union and United World Congress of Diplomats. I want to confirm if he is here with us today. His Excellency here with us. All right, while we're still trying to reconnect on that, I would just like us to move to the next panelist to know if he or she is on ground today. We have Cosmos Rongoti, who is the country director of Amaro Zimbabwe and maternal mental health expert. Is he or her around with us today?
So thank you very much, amiable moderator, Madam Mfunk, for your amazing moderation. And I also want to equally thank Honorable Emeka for your great support. I want to, we're just getting some feedback that they are having network glitches. I have heard from Roti from Zimbabwe, but I want to just suggest so we can maximize our time. Can we, because I see that some speakers in the breakout sections are already in the room. Is it okay we go into the breakout section now? Or do we take some more presentations? I know that we also have some presenters who were scheduled for, or we should just go for the breakout. I want to recommend, or
Yes,
rather,
I think that's fine, sir. I think we could do that. If we're ready, let's just, because of time, we would like to move to breakout sessions, sir.
Okay, so I'm going to be pushing out the breakout rooms, but Ufong, you could just help me go ahead, call the breakout rooms, all the 4 tracks, so people can begin to prepare their minds to know which will best fit their interest to join.
All right, sir. I will move forward with that now, sir. All
Thank
right, distinguished guests, ladies and gentlemen, we're coming into one of the most interesting aspects. I mean, we've been enjoying our time, I would say, but we're coming into the one of the most interesting and interactive sessions of today's conference. And I would like to say that this is where the conversations, become more focused, interactive, and solution-driven. So I would love to encourage every one of us not to just observe, but we should also participate actively in these rooms, that speak most to our passion, our work, and our curiosity as well. We have 4 different tracks, and I will just go into them just to kind of like market it, quote unquote, for us so that we'll be able to make decisions based on our interests, our passion, curiosity, or even our work. So for track A, we will be exploring the topic legal reform and rights framework. I'll take that again, legal reform and rights framework. And these conversations will just span around policy, protection, and mental health rights. That's for track A. For track B, it's focusing on gender, suicide prevention, and lived experiences. And this is just a deep woman conversation that is centered on advocacy, inclusion, and real stories. So if you have a passion towards this topic, you can feel free to join that track. We also have track C, which is going to examine climate change, displacement, and psychological issues across the globe. And this is just going to help us to understand the mental health realities that are connected to global and environmental challenges in general. So if you think that your work is related to that, or you're just curious to know more about that topic, please feel free to join that breakout session. All right, last but not least, we have the track D, which is talking on youth and innovation. And this is for bold ideas, fresh perspectives, and the future of mental health advocacy driven by young people and innovation. So whichever room you choose, there is something valuable waiting for you there, which I know you would agree with me. And we have our, we have people who are already in the rooms to take us in that breakout session. So please, let's feel free to join any of these tracks. Thank you very much.
Thank you so much, Mfong, for that assiduous introduction to the breakout section for this international conference. So please do well to quickly join the rest of the breakout rooms that will fit your interests. Please, maybe your experience or the conversations you will want to be part of. Let's do that. Our breakout section B speakers, please do well to also join. Please do well to also join the breakout rooms you're leading. Please, I can see a couple of us already on the call. Precious, please join your own breakout room and please take control. We will have just about 30 minutes of conversation, and then we will reconvene back to the plenary, and then we will expect 4 presentations because people might not be able to join 2 groups at the same time. So when we return, we will be having 3 minutes presentation from each of the groups. Each room should be able to give us feedback on what they have been able to discuss so that others who are also participating in this very important conference can be able to take back home some critical learnings from your conversation in your room. Please, let's do well to join the rooms. Please, let's do well to join the rooms. Aaron, please go ahead and join your breakout room. Go ahead, please, and join your breakout room. Thank you very much, distinguished participants. You're all doing amazing. And I'm happy that we're still all intact and much available. Chamo, please join your group that you're leading. Lisa, please join the group you're leading. And let
Dr. Zion, just a reference, if you don't mind. I think some participants are finding it difficult to join the room. If the admin can just walk them through the process, please, in 1 second.
Yeah, please. Also, like, how do we join, please?
Yeah, I don't think they've created the rooms. We don't see them.
Oh, no,
Yeah,
the rooms
how
are
do we join?
the rooms are created.
No, we don't. There's no link for that, sir.
Okay, please check. Please check now. There are 4
It's
rooms
there now.
already created.
There now.
Please check.
It's there now.
Okay, great. Great. So please just join. Just join. If you still have difficulties joining, please let us know. Thank you very much, Dr. Chawa. Let's join. Let's kindly join. Thank you very much, our Vice President, Finance and Admin, Margaret. Thank you so much. Dr. Jackson, please join. I know you will be of a great support. Join one of these rooms and give a good leading conversation. I see our Secretary General, Alaji from Gambia. Please, let's join. Let's join. Our country director from Zambia, Dr. Hope, you will do an amazing work also. Please join. Let's join and let's take the lead of the conversations in the group. Khalid, you haven't joined. Take a room, please.
Hello, could you direct me to the climate change room? I think that's room 3. Admin? Admin? Yes.
It seems other participants are still in the breakout rooms. So maybe we can take a cup of water as we wait for them to come back.
Oh, ne ba na manta zan zo ma maman tafiya da leda. Kada gani sai hali na zo maman tafiya.
Thank you. We are back to the main session. Ms. Inform, over to you.
Hello, please, can you confirm if you can hear me?
Audibly.
Yes,
clear.
sure.
Yes, we
All
can hear you.
right. All right. Thank you very much. Thank you. Thank you, everyone, for actively participating in the breakout sessions. At this point, I would just love to hear from us real quick. Beyond attending, what are the key things that you have learned? What are you taking from the breakout sessions that you just had? So you can just use the chat to just type it in your language, maybe just one word, one sentence, something that you've taken out from your breakout session today. Please let's engage on the chat box, in the chat box very quickly. Can we do that? We have just a few seconds to do that before we proceed.
Interesting. I like that, Mfong. So let's get to read Angie like Angie Ta's language. Let's see if she can write what she has learned.
Exactly. And please, a disclaimer, please, while you type in your language, please let us know what you're saying as well.
Yeah,
Please,
just tell us your,
everyone.
yeah, maybe they can just tell us their
I
country
I
and then the
can say
language.
thank you thank you. I can spell it.
Mfong, if I have your permission, while we
Yes,
wait to
sir.
get the feedback,
Okay,
we can
sir.
quickly take a goodwill message. We take a good message from Professor Oshinowo.
Please, let's go ahead with that, sir. That's fine, sir.
Okay.
While we have people comment on the chat box.
Great.
Okay.
I also want to acknowledge Lady Diana. Thank you very much for joining. A very special guest of honor. We will be having you too. So let's please appreciate and welcome Professor Oshinowo.
I've been putting I'm manak you.
Legally, oh yeah, we have mana is here.
This is your position.
Professor Oshinowo, do we have you? Okay, so
I think that she might not have left the left own breakout session class. I think she struggled with network of joining, something like that. So she must still have problems. Please, can you hear me? I think my network.
Okay, so maybe she hasn't joined back. Is it okay? Is it okay Lady Diana, are we having Lady Diana for today or tomorrow? I just wanted to confirm.
I would like her to be today because I know her bucket is quite full, unless she will prefer tomorrow.
Okay, so please catch up with Lady Diana. Let's just know. But in the interim, let's have the reflection from the groups. Group 1, do we have a presenter to give us a feedback? Have we appointed somebody? Group 1? Uh-oh. Who was our facilitator in Group 1? So I'm not sure I'm being heard now. I'm not sure.
I can hear you clear, sir. I can hear you very clearly.
Oh, good. Oh, good. So please, who is giving us a recap from Group 1?
Now, with your
Okay,
permission, while we wait for those moderators from the breakout sessions to give us feedback, can I read a few comments from the in-chat box? Can I do that?
please go ahead.
All
Please.
right. Okay, sir. All right. So we have from Deborah Owino. She's saying that I am glad I have learned that the government of Kenya is doing something with regards to flood. And as a mental health provider, I would like to know what role I can play in that project. And she also heard of lived experiences and she's greatly challenged. So we thank you, Deborah Owino, for that comment that you made. I'm sure that will get across to you on the role that you can play in this project. Thank you very much. We also have Nanji all the way from Zambia. She's saying that it was very insightful and inspiring, and she's saying, thank you, Amral. Thank you so much. Another is saying that I learned about the power of lived experiences. I think that is beautiful. Thank you very much to everyone who commented. Thank you. You can tell me for a fact that Amral is doing excellently well, and it wasn't a waste of your time at all. Mr. Aaron, if you can hear me, please can you unmute your mic?
I should unmute. It's already muted. I don't know. Hello?
Go ahead, sir. We can hear you.
He wants me to speak out.
Yeah, I think you led one of the groups, right? The breakout rooms.
Okay, thank you. It was
Yeah, just give us 2 minutes recap.
Yeah, it was just unfortunate that we did not listen to one of our speakers. She did not really foresee her presentation earlier, and we missed up on that. Hope she had a time to present another time. Howbeit, we had a wonderful engagement from our group, and I want to say thanks to all of our members from the Group 4 section, Track 4, and where I presented on the topic, combating drug abuse and promoting mental health about young people. And we had many meaningful questions asked on the presentation. And of course, we responded, and others also made their contributions. So I think it was good. Thank you for the opportunity. And we look forward to learning more from Amro as we all help making Africa a mentally healthy Africa for all. Thank you, sir.
Great. Thank you very much. Thank you. Do we have other group leads that want to share a feedback, or any representative you want to share? Because we want other delegates who were not in the room to just take home something, from your group. You might not give in detail, but just give us an idea of what you enjoyed in the group so that we can also take a pinch of it.
Hello, can I speak?
Go ahead, Gladys.
Hello?
Go ahead, Gladys.
Okay. Okay, my name is Gladys Chibuza, Pastor Gladys Chibuza from Nigeria. I was in the group 2, gender and in our group. And we are the mental health and gender. So one of the things we have found out from the people that made presentation there is it boils down to the fact that culture, non-belief of community of people played a very challenging role in the mental health of people. Because from what we heard and from what people presented, you see how instead of looking at someone's health, they're attributing it to the norms and belief, witchcraft and all those things. So the earlier Africa begin to play down on the issue of culture, and norms that are repugnant to natural justice, equity, and good conscience, the more we will get brighter in getting there. And also, we look at the issue of gender-based violence. Gender-based and domestic violence also affect mental health of women in our society today. And I just want to chip in this one too, that one of the things now that is playing negatively on the mental health of children now in Nigeria is the issue of insecurity, that our children are not even free to go to school for the fear of kidnap, other things, sexual abuse. But people, we don't know. People don't recognize the fact that even children, they have mental health to be protected. And how do we protect that? How do we prevent that? How do we protect them from being exposed negatively to their mental health? Thank you.
Thank you so much, Pastor Gladys, for that amazing submission. And it's really a concern where students, children are traumatized, waking up in the morning and preparing to say they're going to school. They don't know what's going to befall them. Are they going to come back? Are they going to be kidnapped? Are they going to be molested? It's so terrible. And please, we can shed more light on these. Is this the reality also in your country? For those of us who are joining from other parts of Africa, what's the reality of young people in your country? What's like the reality of education? Are students comfortable? What's like the mental well-being of students, right, in your country? Can we have more conversations on this, please?
Hello.
Go ahead, sir.
I'm sorry. My name is Abdurrashid Abrahaman. Even though I have joined the conference late, but I apologize for that. I want to shed more light on the earlier speaker who narrated the issue of Nigeria. I'm also from Nigeria too. Mental issue in Nigeria is like issue that keep persisting. But sorry, I would like to acknowledge the two earlier speakers, the doctor and the lady, for wonderful life story. The things that has been learned from their story is that nothing impossible. Their life story explained that nothing impossible. That is, any issue when give much concern, it will be cut off, and it will be end up without having a manifestation of complication on that case. So in Nigeria here, we still faces issues regarding children mental health. You will discover that a little that is underage, a little boy faces mental cases like trauma and so on. With the life experience that he has encountered or faced on his life, which is possible to cover. In this point, I will now keep emphasizing on the much health allocation to the mental health reform, which will betterly help cover such issues and to prevent these kind of issues for right. So as I have said earlier, I have so much to share because I have joined the conference late. I have been trying to join, by a code. So this is what a little bit have culture from the in the thank you.
Okay, thank you very much for that intervention, for that kind comment, Abdurrashid. I understand that there are some of our speakers for the breakout sections that were unable to make presentations. Can you please identify so that we can give you your 45 minutes and we could just hear you as we prepare to wrap up after our last week good message for Professor Shinowo. There are speakers who were unable to present at the breakout section. We apologize for the glitches and you want to quickly do that. All right, Florence, please go ahead. You have 4 minutes. Please make your presentation.
Good afternoon, everyone.
Good afternoon, Florence.
My name is Florence Ntazana, a psychologist from Zambia. I'll briefly talk about my abstract that I was supposed to present in full. My area of expertise is dealing with medical trauma and non-communicable diseases in children and youths. My research is based from Zambia, Lusaka, UTH, DBROC, and Family Legacy Mission Zambia. I deal with children with epilepsy, sickle cell, and a lot of non-communicable diseases. And my research is centered on understanding and us looking at the view of looking into mental health being part and parcel in the treatment of medical conditions, more especially for children. So the abstract gives a lot of information about how psychological treatment helps children manage their everyday lives and conditions, because when they have these conditions, they are isolated and end up depressed or live in a state of anxiety and fear. So as psychologists or as mental health workers in Africa, we should venture more into working together with other expertise like medical doctors in managing conditions that affects our youths and children. My goal is to make sure all children understand that healing starts in the mind. What the mind sends out across the body responds and it's able to help in the healing process, unlike they are just taking medication without managing their mental health. Thank you very much.
I thought I would be seeing some emojis, some celebrations, some uploads. I mean, that's really good to have the understanding of what's happening in that context of study from Zambia. Thank you so very much for sharing, Florence. We do appreciate that. Thank you. We will also like to have your full paper and then we'll add it to the report of this conference. Do we have more presenters who okay. Onu, please go ahead. Unmute your mic. Nyota, please unmute your mic and go ahead. And Precious Anselm, please prepare. You will be speaking next. Go ahead, sir.
Okay. Good afternoon, sir. Please, if there's an error, I am not one of the speakers. I wanted to send an emoji, so I mistakenly sent that one. I'm sorry about that. Thank you.
You wanted to send?
I wanted to react to the last speaker.
Oh, okay.
So I
Okay.
mistakenly placed that one. So I'm sorry. I'm not the speaker.
Okay. Where are you joining from? Where are you joining from?
Okay, I'm from Nigeria.
Thank you very much. Thank you. All right, so let's quickly welcome Mr. Precious Anselm for his presentation. Precious?
Okay, good afternoon, everyone. So I think my group already did justice to a whole lot of the things we would have loved to say, but I just wanted to say this, right, that first of all, we can't really do mental health reforms in isolation. And I love the fact that when Mr. Emeka shared his story, he let us understand that he's not a trained mental health professional at the very beginning. He was an accountant by training and he has moved into the space. So that tells us that we can't do this in isolation. All hands have to be on deck. I remember when HIV became a mainstream thing, especially in Nigeria, stigma and discrimination was at the height of it, right? People don't want to share cups with people living with HIV. They don't want to share towel. They don't want to share the same space. They didn't want to share the same spoon. But today is not the same story. Why? There's been a lot of work, a lot of reforms, and we've been able to minimize or almost remove the stigma associated with HIV and AIDS, to the point that we even have a legislation in Nigeria, for example, that criminalizes suicide, that criminalizes HIV discrimination and stigmatization. And I believe we can achieve the same thing in mental health. But it starts with us stakeholders, right, being involved in rooms where those decisions are being made. Because when you do the top-down approach in trying to do suicide prevention, for instance, you won't make much headway. Because people making those policies should be people who have lived through this or are living through it, people who have experienced the pain that comes from it, people who understand what it means to be stigmatized against or to be discriminated against or to have to live through or to live with a mental health condition. And I want to believe that if we, get the approach right, we could begin to see serious changes and reforms. But it's not going to happen in a day. Right, it's going to happen, but not in a day. Eventually, we will get there, but it's one step in front of the other. And I can tell you that we've actually made a lot of progress as a country. We've made a lot of progress as a continent. But suicide prevention has to start from suicide decriminalization. We need to understand that as long as suicide is a crime in a lot of countries, we will not be able to hit at the root of the problem. We'll just be doing surface dressing. But once we are able to remove that stigma that comes with criminalizing suicide, people might be able to seek for help. People might be able to speak up. But when someone is going through stuff and they even have suicidal thoughts and all of those things, they are scared to share. They're scared to speak up because they don't know what people would say, what people would do, what the government would do to them and all of those things. So I want to say that as stakeholders, we need to start championing those conversations. Everywhere you find yourself should be your own breakout rooms, right? Have conversations, educate people. There's a whole lot of ignorance when it comes to mental health. There is a whole lot of ignorance when it comes to mental health. A lot of people are roaming the streets with different mental health issues that are treatable or could have been managed. But because of ignorance on the part of their caregivers, ignorance on the part of their family, and the stigma that comes with it that prevents people from even seeking information and knowledge, we end up having treatable issues roaming the street. These are things that could have been avoided or managed, but here we are. So everywhere we find ourselves should become our breakout rooms, a workplace, whatever it is that you do on a daily basis, always find a way to impute mental health into it. Your WhatsApp status is your platform, your Instagram page, your Facebook page should be your platform to preach the gospel of mental health reforms. And if we can do all of these things collectively, we'll end up doing what we call a snowballing effect, right? And we'll end up making a whole lot of progress. So that's what I just wanted to say. Like I said, the breakout room I was supposed to speak at, we had a lot of we had 3 persons that shared their story, and trust me, that did a whole lot more than any presentation would have done. Thank you very much, Mr. Zion.
Thank you very much, sir. Thank you. Mr. Zion, please, if I may interrupt right
Go
now,
ahead, please.
I would like
Go
to
ahead.
ask if we could take Lady Diana Eyo Enoite, who is the special advisor on SDG matters to the governor, Delta State, Nigeria, if she can just, give us our own speech very, very quickly, Please,
Sure.
distinguished guests, ladies and gentlemen, please can we use our reactions, our emojis to welcome Lady Diana as she gives us our own speech. Please, I'm so sorry for that interruption, but we need to take her now. Thank you.
Good afternoon, everyone.
Good afternoon.
Can you hear me? Okay, nice. Good afternoon. And thank you so much for the kind invite. I want to also thank who I will call our Delta and probably Nigerian voice, Mr. Emeka on this platform, who has not given me a breather, not a second of breather, and has pushed and pushed and pushed that I have to put my voice to this conversation. I am humbled and I see it as a privilege to put my voice in the conversation. I've been in and out since about 11 a.m. listening to all the brilliant presentations that have been coming out of this room. And I've just been asking myself, why are we doing this over the phone? Why are we not seeing ourselves and actually shaking the tables and making the difference? But today I will be briefly speaking. I'm not sure that I was supposed to be reading a speech, but I was supposed to be in a panel. But I just want to talk about the subject that my panel was supposed to address, which is strengthening continental collaboration and diaspora engagement for mental health financing in Africa. And the burden of disease in Africa is about 15%. The global burden of disease in the world is 15%. Yet the whole world, and I mean the whole world, still gives less than 2% of their health financing to mental health. And it breaks my heart as a person because I begin to ask, how did we get to the point where we did not realize or we have not realized that our body works first with our mind? And I always say that a surgeon would say that I need the patient to be willing to fight, which means mentally the patient needs to see themselves coming out of that surgery successfully before they even start their surgery. But yes, as critical as that, as the mind is in the space of health, yet it has been separated from health in itself. So many countries across Africa are struggling. We have our young people struggling with depression, but yet they are not seen as unwell. We have our mothers experiencing postpartum depression, and yet is either not diagnosed, but yet the community is judging them. We have young people, young men particularly, or a lot of men right now, struggling with anxiety in an economy that is, stiff, and yet they are being told to man up. We have young girls struggling with depression and peer pressure, but yet they are being told to fit in. In many cases, help is not just unavailable, it is invisible, it is inaccessible, and it is unaffordable. Currently, I'm doing my PhD on transpersonal mental health, and my focus is on trauma and as it relates to women in faith-based organization. I chose this bit of work because as Africans, we have brought culture, tradition, and faith is key to how we respond to every situation or how we approach every situation. And if we look at the limitation that we have as it relates to mental health in Africa, our culture, our religion, and our tradition has affected it. And more, my research has shown that women are unable to express their agencies in faith-based organizations because they are being judged by the several mental health issues or crises that they are going through. These crises have made them as cost limitations, and in the places where they've gone to seek the help of the divine, they are yet judged or set aside as a result of their cases. Now, mental health in Africa is not yet positioned as a system priority. And I think that is the first problem we have in Africa. We maybe because of COVID, I guess we are lucky that because of COVID, the conversation is even being had in its bits and pieces everywhere. And I was listening, and as the last speaker was speaking, I wrote something on my notes. I said, we need to stop to preach to the choir. Every one of us in this room, and I say that, with little or no information, but I could say that 80% of us in this room are people who already know the subject, understand the subject, or are passionate about the subject. Now, where are the people who are going to make policies about the subject? Where are the people who are going to render selfless service about the subject? And where are the philanthropists who are going to bring in the funds into this subject matter? So yes, funding is low, service is scarce, and the system is already created in a weak format where the service cannot even be given. So I'm thinking, I'm supposed to talk about all the problems and all the social and economic and developmental crisis that we already know in this room that not addressing mental health is going to bring. I just want to talk about 3 things that I feel like is going to strengthen and help our financing for mental health in Africa. 1, I believe that we need to build a system we need to build a structure in the existing structure. And what do I mean by that? That healthcare should be seen not just as care for the body, but care for the mind. And from the reception or the emergency area of a hospital all the way to the surgical area of a hospital, that the whole supply chain system should be created to not just treat, but to identify a mental health crisis. One can go into an emergency ward complaining of heart palpitation, sweating, and feeling dizzy, or even in a state of fainting. And the truth might be that that person is actually suffering a severe depression or anxiety breakdown. So we need to create a system where from our emergency rooms or our community healthcare centers and even our schools and our churches, where we can, our mosques, where we can identify, and that system is regulated in a way that people can come into the emergency ward because they are having a nervous breakdown, not because they have a cut or in an accident only. So I think that's the first system. And once the system is restructured to identify, when an identification is done, a problem is then seen, then that problem will lead to a solution. The solution will then be that because we have cases of people coming to emergency ward with anxiety breakdown or severe depression or amnesia, then the system will create funding in it to address those issues because it is now identified or structured. I think that we also need to think more of diaspora money as a structured investment and not just lavishing. Every African country needs to begin to create systems, whether by taxation or other forms of policy, where the diaspora funds are now, put into a, let's say we call it a diaspora-backed mental health fund system. In Nigeria, I actively worked with Bill and Melinda Gates Foundation and the Rotary when we were actively working against eradicating polio in Nigeria. There was a basket fund that was funded by Bill and Melinda Gates, Dangote, and the Nigerian government. And these basket funds, if I can remember clearly, of about ₦1 billion from each of the donors was going into eradication of polio. Why can't we have that in Africa? Or why can't we have that in each African country represented? Basket funds that is targeted at solving and doing research around mental health issues. We also need to put into our health insurance, a mental health pool. The Nigerian insurance system right now does not cater for mental health. So I can't go into my hospital and complain of a mental health crisis and my insurance will sign off on a care. It's not there. So we need to fit in mental health care, from mild cases to severe cases into our insurance models, right? And the government needs to channel funds into this. Right. So now, I think my other point will now be, as I thought about this, I said this whole thing of us, even as Nigerians, we call ourselves the giant of Africa. But what is one giant in a forest? That giant is, ineffective. So I think that we need to stop working in silos. Conversations like this needs to go away from just presentations to collective solutions that can now be streamlined and implemented. So why can't Africa, like the United Nations, introduce the global goals, the SDGs? Why can't Africa or mental health specialists and professionals like the people in this room come up with mental health goals for Africa to attain? Why can't we have a global and continental dashboard, where, organizers like this we are imputing cases across Africa, and we're able to look at our continental dashboard and say, you know what, depression is going high. Why? Trauma is going high. Why? In Nigeria now, a lot of our insecurity level, the measure of it sadly has now streamlined itself to children under attack, children being kidnapped. As someone myself who was kidnapped at the age of 5, I wrote a piece the other day titled "We Never Leave the Room." I understand what childhood trauma and how childhood trauma can shape personalities and actions moving forward. And yet we are in a system where even when we do succeed, so help us God, to bring back these children from their adopters, we do not have any regulation system put in place, whether in our hospitals, schools, or even faith-based organizations, to help these children deal with the trauma. You might call it a simple trauma of not just even being at home for 24 hours. We don't want to even talk about all the other things that these children has faced. So I think that as a continent, a global dashboard, a continental dashboard, a continental funding mechanism should be put in place. A continental approach, coordinated approach, which we can have a presentation, and that could be a good takeout from this kind of conferences. Why don't we, in the next African Union general meeting, present the findings, the collective agreement or suggestions from this kind of discussions to the African Union, where funding mechanisms can be put in place, continental policies can be signed by heads of state, and implementation can be measured and streamlined under KPIs that the continent has agreed. When it comes to mental health, I could speak forever, but I think that for the financing to even be considered, we need to step up our advocacy and stop preaching to the choir. We need to step up our awareness creation so that, like the speaker that was talking about the HIV awareness and acceptability in our communities now, it's awareness. We need to step up the awareness where someone who is going through anxiety can actually say, I'm feeling anxious right now, and it will be okay. Where men can cry and they will not be told that men don't cry. We need to normalize this subject in the first place before we start to speak about financing it, because funds will only go into areas of political interest and willingness. And if a subject has not become key, the political players will not see the necessity to put in funds or prioritize that issue. Insecurity in Nigeria gets billions and billions of naira every month because it is real, and as real as our mental health crisis, and it is felt. And as much as individuals are feeling our mental health crisis, and it is prioritized because people are crying out for it. So maybe as individuals, we need to do more, and as a collective, more in terms of our advocacy and our awareness creation. So let me round up by saying, harmonize policies as a continent to solve this problem, create pool funding and resources, ensure that collective data, which can happen through our dashboard, and sharing of that data is done, and build systems that are not just scalable, but they are sustainable. Financing mental health in our continent as Africa is not just a priority, it cannot remain an afterthought or a conversation in rooms like this only. It is a priority that needs to start by looking back to our cultural, traditional, and faith-based institutions and scaling up this conversation beyond this room to all the way to the African Union, where heads of state can make the right decision. If every country in this particular room right now builds alone, then we will build nothing. But if we decide to collaborate and build as a continent, we will build together and we will be able to create scalable impact for our mental health in Africa. Thank you all so much for having me today. God bless you.
All right, thank you very much, Lady Diana. Thank you. Please, can we use our emojis? She's done beautifully well. That was very remarkable. Thank you very much, Ma. Distinguished ladies and gentlemen, while we applaud and appreciate Lady Diana, I would just like to say that we are gradually drawing the curtains on what has truly been an impactful and enlightening session today. And at this point, please, I would like us to proceed to receive a goodwill message from Professor Chidi Onoha. Please, Professor Chidi Onoha, are you here with us? So that we can take your goodwill message.
Yeah, thank you so much, the moderator, and thank you, the organizers of this epoch-making program. Mental health is this primacy, and I'll be talking about climate change and trying to encourage us to also the organizers make sure you impute climate change issues and in this mental health conversation. Because the World Health Organization done that. And I also believe that Africa must, as a matter of fact, see this hydra-headed monster called climate change to be brought into the loop as well. Because when you begin to see the pollution, the air pollution issues, for instance, within the context of Nigeria, Niger Delta, the soot phenomenon. And you can imagine the dangers and the psychology of people getting engaged with these respiratory diseases and all of that. Women who has to travel hundreds of miles because of drought and desertification in hectares for firewood, because we have lost the mangrove, we have lost our forests in terms of drought and desertification. Of course, drought is at the rate coming within the African context over 0.7 kilometer, per annum. That shows you that climate change is not something you treat at the periphery when you're bringing this discussion on the mental health. It's very, very critical, and I just want to encourage us. What we have started now is very, very critical. I don't know in terms of policy issues. I was in the group one. I came in that session. I was trying to say, please, all of you should, as a matter of fact, in your policy issues among the 54 countries of Africa, Sub-Saharan Africa, ensure you integrate climate change issues in your discussion on mental health. I totally agree with the last speaker. When you cohere, when you collaborate, you go far. A lone ranger does not go far. We need to really collaborate into ensuring that the issue of mental health is really brought to front burner. I totally agree also. Yours sincerely was part and parcel of the SDG that came to fruition in 2015, right then in United Nations. I was part of the African team. We met there in Midrand, South Africa, under when the Pan-African Parliament, managed that. I would come up with a project, and the mental health issues was one of the subsets, in terms of environmental and health issues that we took to New York. So I'm excited with even the Climate Change Act, which we also developed for Nigeria. The issue of health, we saw economy. Climate change has made us to look at the economy, have an economy-wide approach to issues, not sector-specific targets. Because the climate change affects both agriculture, the conflict. The conflict we have in most African countries, because within Hada and farmer class, is climatic, issues and all that. Because when we have lost the grassland, they are moving down south to act in search of green or greener pasture, as the case may be. So I just want us to, as well, this goodwill message, please try as much as possible in your policy document across the 54 countries sub-Saharan, make sure that climate change issues are imputed. But by so doing, you will be making a statement of ensuring that this conversation on climate, on the mental health is brought to a larger audience, and we never know where you can this access to funding and all that in terms of the adaptation, because it's about vulnerability issues now. So I'm encouraging the organizers. Thank you so much. On behalf of West African Green Income Development Institute, Wagedi, we are very proud of the milestones you have recorded. Thank you, and God bless Africa.
Thank you very much, sir. Please, a round of applause. Please, can we use our emojis to Appreciate Professor Chidi Onoa. Thank you so much, sir. I see that we have somebody raising his hand. We're drawing the curtain now. I would be inviting Mr. Zion Ahmed to do the roundup, but I think I saw somebody's hand. I think Yasin wanted to say something. Yasin, are you with us?
I'm here. Thank you for the recommendation and the presentations to all of the speakers. I think you asked for those who were not able to present during the breakout sections, and that was how I raised my hand as a concern that I wasn't able to present during that time. Better still, if we don't have the time, then it's okay. But I thought to also share some concerns as it relates to mental health. So for those who are listening, my name is Nelson Tieto Jr., and I am a counselor educator on the Mental Health and Epilepsy Project in Liberia. And like everyone has said, mental health is a critical part of human well-being. I mean, the critical part that affects how we think, how we behave, and interact on a daily basis. And for country of Liberia, where mental health remains a major concern, or public health concern due to the long-term impacts of civil conflicts. As you all know that we have had 14 years of civil war, and poverty, unemployment, and that of substance abuse, trauma, and the list goes on. There's still some limited access to mental health services within Liberia. And if you compare and contrast that with the data from the Liberia mental health policy and WHO supported estimates, there's a challenge of approximately 400,000 people who are still affected by mental health, different mental health conditions, both neurological, substance use disorders, and more than 130,000 people are still living with severe mental health conditions. So from my experience on the field, I get to understand that the most frequently reported cases that we see has to do with depression, anxiety, PTSD, and that of psychosis, schizophrenia, particularly bipolar disorders, suicide-related issues, and stress. So, but then there's something specific among these things that has to do with substance abuse among youth. And you know that Liberia has a growing population of 60% young people, and having the youthful population being the fastest growing concern areas contributing to violence, school dropout rates, that of employment, and family breakdowns and things. These are major challenges that is key for all of us to look at. Why it is true that we are looking at it from our different countries and things, because these challenges are associated with and it's not different from what others are going through in the different countries or experiencing. It has to do with stigma and discrimination, where many people still believe. I think this is the first major challenge that I've seen, where many people still believe that mental illnesses is caused by some level of witchcraft activities and some level of family issues and things. Of recent, I had an experience on the field where we have these activities going on to meet traditional leaders, traditional herbalists, or religious leaders and thing. And one of my experience of the cases that I was able to see, that was a religious person saying that she managed to heal an epileptic patient. And I was concerned as to what mechanism did she use. And she was just telling me that she just prayed for the person to begin heal. I mean, after suffering from epilepsy for more than 8 years. And these are major. So it tells me that most of those who are around associated with healing practices and things, these are people who are not knowledgeable about what they are doing, and they're not knowledgeable as to how to distinguish between epileptic cases or mental issues with that of spiritual issues. They still lack the knowledge of distinguishing that. However, there are progresses being made when it comes to integration of mental health into primary health care, and I must commend the government of Liberia for that, and increased training and awareness from NGOs to other local organizations that are still going on, expansion of community mobilization services, and that of the increased government budget that is allocated to mental health. So there's still work going on. And when I joined the conversation during the beginning, something I said there, if you check my chart, I was like, how can we lift up, how can we integrate this forum from just this conference to a level where it can be the whole network, that we can keep communicating issues of global concern, and how can we support one another in our different works. So I want to say thanks to all of the presenters who spoke on the platform. I think your cases are not different from those cases that we are experiencing in Liberia as well, and it is a good thing that we can help one another, and we can create a space where we can listen to one another problems and solutions.
Thank you
and
very
we too
much.
can be able to have a cross-sectional recommendations from your side into how we can integrate that into our mental health
Yes,
services
thank
in
you.
Liberia as well. Thank you so much.
Thank you. Thank you so much, sir. Thank you for that. We would move, before I call on Mr. Zion to wrap up, I would like to ask that we for our pictures, please, let's just show our faces so that we can take a picture. Everyone, please, can you just, show your faces, just remove the, just show your faces so that we can take a picture real quick. All right, so we're taking our pictures now. So all our participants, that we see your faces so that, we'll be able to take a picture. Everybody, let's do that. Let's do that real quick. Mr. Ame, over to you, sir.
Okay, let me put it this. I think it's good like this. We have better a full screen, so we can take a better picture now. I'm really excited that we still have over 50 people still on the call. I mean, this is really encouraging. I know tomorrow we can do better. We can invite our friends. We can invite some of our community members, and let's see how much we can do this together. Some people are still angry with us. They have refused to on their cameras, but no problem. We still appreciate you. Don't be angry with us. We're closing now. You will hold Ufong and Honorable Emeka for your lunch. You hold them. They must serve you your lunch.
We're deeply sorry for that.
Okay. So thank you very.
We'll get a virtual lunch, There's something called virtual.
Thank you very much. I mean, I can't thank all of you enough for, your show of commitment to the subject matter of mental health in Africa. I can't thank you enough. You have shown a lot of commitment, resilience, and effort to ensuring that you are also contributing deliberately, intentionally, to transforming the mental health reform system in Africa. And we sincerely appreciate all of you. Maybe before you go, you can just again type just your name and your country so that we can keep tap with all of you. We'll be returning back tomorrow to close on day 2, same time, 10 a.m. Please let's join on time, and then we'll see how much we can make justice to the time. I see my brother Olu, our country director from DRC Congo. Thank you so much for joining. I see also our board members still holding on till now. Thank you so much, Angie. Thank you, everyone, for your commitments. I mean, I might not be able to call all your names, all our speakers, amazing people. Thank you so much, Lady Diana, for that amazing presentation. Just like you might recall in my presentation, my opening remark, I've mentioned that we will be launching something that we call Pan-African Mental Health Reform Care an intelligence system. We'll be developing and launching that dashboard to be able to guide concerted research work from across member states, where we will be uploading status around mental health policies, legislations, budgetary allocations, implementation status, and much more. You did mention the status of people coming down with mental health conditions and some other statistical data. We will be doing a lot of justice to that. It's just a starting point, and we hope to partner with a lot more universities and research institutions where we will be feeding these dashboards and making out annual reports and programs from them. So thank you very much for your submission. I also want to thank Professor Chidi for again reminding us. I'm sure those of us who were in the climate breakout section, you can resonate clearly with his submission. We need to do a lot. We need to see how we can integrate mental health conversation in the climate movement across Africa. Whether it's in terms of drought or deforestation or in terms of flood, there's a lot that's happening that we really need to look at how people are psychologically impacted and then come up with some intervention that can close up and also help create climate resilience across Africa. I want to thank all of you for your time. I'm especially indebted to Dr. Sarah Kine, the CEO and the co-founder of the United Global Mental Health in UK, for her amazing presentation. Professor Pinamam, Professor Obindo, Mr. Ogumba, our lead researcher, keynote speakers. Thank you everyone for making this day one a reality. I have no doubt tomorrow is going to be better and we're going to have much room to discuss. Tomorrow is going to be more practical. We'll be looking at ways we truly can help ourselves, ways we can truly concertedly put some building blocks, beyond rhetorics, beyond theoretical presentation. How can we move forward? And we'll be coming up with communiques that will be driving through some media platforms across Africa. So thank you very much for your time. We'll also be we'll be recognizing and awarding some few persons in Africa that have led some very amazing works around the mental health sector across the continent and the globe. So thank you very much, distinguished ladies and gentlemen. Until we connect again tomorrow, same time, please let's keep driving this conversation at our own different spaces. We have shared our social media handle. Some of the conversations from today's meeting will be reposted. Do well to add more comments, do well to repost, do well to and tag all of our African health institutions, Africa CDC, African Union, ECOWAS. Let's tag them, because this conversation must be taken seriously by them. This conversation, they must be involved, and then we'll see how we can take it to the next level. I'm very hopeful that 2027, at the 4th edition of our conference, we'll be seeing ourselves physically in the country we will all be choosing. We will make that vote tomorrow, and we will be choosing the country we will be meeting for 2027 for our next International Mental Health Reforms and Care in Africa conference. Until we meet tomorrow, distinguished ladies and gentlemen, this is love from me to you all, and thank you sincerely. I also want to acknowledge our big brother from Cameroon, Thierry. Thank you for your submission. We will hear your full presentation tomorrow. Thank you, everyone. I might miss to call your name, but please understand that you're dear to me for staying till this time. Every one of you are very, very special. Prince Next, thank you for what you're doing on the dashboard. Grace Bello, thank you for engaging all the delegates. Let's keep engaging and making sure that all the over 300 people that have registered, let's get them on board. Let's get them into the room and let's have this conversation. Thank you very much, Shamu. Thank you, Ashawa, Dr. Jackson, everybody. Thank you. Afikali, Wanja, your group, Zulu, everybody. I might not be able to mention all of you. You're just so an amazing group of persons. Madam Nancy, thank you very much for your presentation. Thank you. Thank you so very well.
And thank you, everyone. See you tomorrow.
We have a very good evening, and then we'll connect again tomorrow.
For now, yeah.
Thank you.